Thank you, Mr. Chairman. I want to thank all of our witnesses for testifying today for this important discussion. First, let me extend my sincerest sympathies to the Rockwell family for your indescribable loss of Logan, to you, your husband, and your son. I'm very sorry for the loss of your beautiful boy. You have lived a nightmare that many parents fear. My family faced the diabolical opioid crisis ravaging this country because our middle son was addicted to opioids, and we went through an awful lot of trauma around that and misunderstanding him and what was affecting him. And he is now 10 years in recovery. And I think it is really only but for timing, perhaps, that we didn't lose him to fentanyl, because 10 years ago, it was not so prevalent. So God bless you and God bless Logan. And I want you to know that we have a bipartisan new caucus, and it is bipartisan, to work in a bipartisan way, and it's called the Bipartisan Fentanyl Prevention Caucus. So I'm delighted to join Rep. Issa, Rep. Neguse, as well as Rep. Calvert to work on this issue, to save lives. During both the Trump and Biden administrations, the federal government noted increasing numbers of overdose deaths. People have said it here today, 108,000 in 2021, 70% of those involving fentanyl poisoning. So treating fentanyl and related substances with severity, as the Biden administration and the Trump administration did, is one step. Just last year, Congress authorized $60 million for additional CBP officers and $70 million for inspection technologies. All of those things are what we must do. We know that much of these substances is coming through legal ports of entry. The result of that investment was an additional 13,000 pounds of fentanyl seized. So I wanted to just ask you, Mrs. Rockwell, if you'd like to say just a little bit about Logan, and then I was going to ask Dr. Singer for some public health recommendations.
Well, obviously, Logan, thank you. Logan was very young when he passed. He was 19. So he was our oldest son. He was a real good kid. He was a vulnerable kid, and we sort of felt like we obviously lost out on so much of his life. Logan, the night he passed, he was upset. He was distraught. He was extremely upset. His girlfriend and him were fighting, and he was on FaceTime and took the pill while his girlfriend was on FaceTime with her. He sought out the pill on social media, and that's how he passed.
I'm very, very sorry, and this committee has heard from other parents who have lost the indescribable, heart-crushing loss. Dr. Singer, in your testimony, you talked about the sadly, natural progression of this drug crisis. This one began with pharmaceuticals, evolved to heroin, then fentanyl, now synthetics, and now we're even talking about tranq and some other horrific substances. What are the right public health solutions? I really believe we have to think outside the box. We can't be afraid to embrace that people, not just addicts, but those who are addicted and those who are just experimenting are at grave risk of death. So what are the public health things we should be doing?
Well, thank you for that question. In fact, what we need to do is, instead of just focusing on the supply side, we need to focus on protecting people who are using drugs from the dangers of fentanyl and other even more deadly contaminants. I have a chapter actually in the Cato Handbook for Policymakers that was just released that deals with this. Among the things that this committee could do is, for example, our drug paraphernalia laws make it illegal for a person to hand out a fentanyl test strip, or now they make xylazine test strips for tranq, because that's considered drug paraphernalia as testing equipment. Many states are changing their laws to allow that. Both red and blue states, South Dakota did last week, Arizona did a year ago, but there's also federal paraphernalia laws. Another very important thing, in my opinion, is for this committee to consider either repealing or amending 21 U.S. Code Section 856, also called the Crack House Statute. I have a policy brief that came out yesterday about this. Overdose prevention centers have existed throughout the developed world since 1986, when they first started in Switzerland. They're in 16 countries. There are 147 of them in 91 locations. We are an outlier. 38 are in Canada, 25 are in Germany, 14 are in Switzerland. But we're an outlier because our federal law prohibits people from helping their neighbors by setting up centers where they can be brought inside and used in a safe environment and have people standing by with naloxone.
I see my time has expired. I thank you both for the conversation, and I couldn't agree with you more. I said to people in my district—
The gentlelady's time's expired.
I agree with your recommendations. Thank you.